Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
It looks like you've got the record all in order here. You've got a good health history. There doesn't look like there's any problems at all. Mr. Treves, I think we can go ahead and get started.
I had a question, though, Doctor. See here, in oral diagnosis, a treatment program was made for an extraction of a tooth. And I just checked her over, and I don't think that tooth needs to be extracted.
Yeah, but didn't they send down an extraction slip? I'm sure they did. Sure,
yeah, there's one in there.
Here.
Yeah. Well, that's what I'm questioning. I don't think the tooth should be extracted.
Well, they sent the slip down. When they send a slip down, they've been examining this patient and keeping her under observation for, over 6 months. And they should know more about what needs to be done for her than you in a 5-minute diagnosis. Why don't you think it needs to come out?
Well, a couple of things. They said that it's mobile, and I checked it, and it isn't. And they said that there's a granuloma on the end of the root, and this X-ray I retook shows nothing at all. It's just a slight hint of a radiolucency there.
Well, a slight hint is a radiolucency. A slight hint means a lot of problems. It could mean that she's been having problems with that tooth for a long time.
I don't think so, Doctor. All through our education, we've been taught to conserve tooth tissue, and this is not very conservative, in my opinion. I think endodontics would be a better treatment for that tooth.
How many root canals have you done in second molars?
Well, none on a patient, but I think I can do it.
I think we ought to go ahead and follow the operative staff's recommendations and go ahead and take the tooth out. Let's go ahead and get started.
Doctor, could you check my cavity preparation there on the distal at 29? The cement base has been placed already.
All right. Good afternoon, sir.
Good afternoon.
Mr. Gray, I'm Mr. Manuel Clinical Instructor. If I could just have you open here, I'd like to go. Well, excuse me, please. Mr. Mangum, you come over here for a minute, please. Where did you get this patient?
Just assigned.
This man has the most disgusting case of bad breath I have ever witnessed in the clinic. Now, I want to know just how many times have you had this man in here as a patient? How many times have you seen him?
4 times.
4 times, and he's still like that? Haven't you said anything at all about this filthy mouth? Mr. Mangum, we are not going to put up with this kind of sloppy hygiene in this clinic. Now, I'm going to speak to the head of the clinic about this. And I can assure you, he'll be seeing you too. Now, I'm not going to check in that cavity preparation. You can't expect me or anyone else to get in there with a mouth like that. If you want anything done about that, you're going to have to clear up that halitosis first. I'm sorry.
Hey, this is big homecoming weekend. You going to get to the parade Friday night?
No, believe it or not, I had an exam Monday and I have not completed grading the papers, and I try to get the papers back to the students the next class session. So,
oh, that's good. You're not going to miss that game Saturday.
Oh, by no means. I will be at the game.
How do you think this one's going to come out?
As usual, another runaway, barring no big problems. You know how that is. So.
You really think we're going to take him again, huh?
Excuse me,
Possible.
Doc. Could you sign my card, please? I've just finished the cavity preparation.
Oh, good. How's everything going?
Okay, so far.
Getting along pretty well with him? Good, go ahead.
Thank you.
What do you think about the team this year?
Oh, I think they're terrific. I love that defense. Boy, they're just almost unstoppable.
Well, I don't know. I think that a good passing team would really beat us, believe it or not.
Yeah, I'd like to see our quarterback open up a little bit. We really haven't had much of a passing game.
Oh, no.
ourselves.
I think I've got an exposure.
Cal, this is a final check on an Inlay Class 2 30-25.
That's right, Doctor. Real happy with that one. That's one of my better ones, I think.
Cal, did I give you the cement check on this case?
No, you didn't.
Well, Cal, in all candor, I like the finish. I like the anatomy.
Thank you. I did too.
But did you really take a good close look at the interproximal on a distal?
Yes, sir. Yes.
Did you check that contact?
Well, sure I did. It was, as a matter of fact, it was perfect on the die.
Perfect, like daylight flowing through from east to west.
Did
you really take a look at that cervical?
Well, of course I did.
Cement
I
is
wouldn't put it in there if I
flowing
didn't.
out of that cervical, Cal. This is strictly in the island of gold in a sea of cement category.
I never heard of a category like that.
It's the redo category. Redo. Emphatically redo. No question about it. It's the end of the line.
Oh, jeez, I think he should get lost in his sea of cement.
What's going to happen now?
We're going to have to do the damn thing over again.
Take me as a member.
Yeah, we went up and pointed out.
Delicious body, and then maybe they'll bring me in for my money.
Yeah, 28 below.
Okay, let's get going on this greeting. We've got a lot of students to go through today. The first fellow we're going to talk about is Ken Berry. He got a B, a B, a B plus, A minus, and a B plus.
He's a good guy.
Yeah, he's the one that played football.
Yeah, he's let him out.
Oh, yeah.
I knew him in a fraternity. He was always friendly. He's helping other people, you know. He's a nice guy.
Very nice fellow.
What's he planning to do after graduation, you know?
I think he's going into orthodontics.
Oh.
At least that's what he's spreading around.
I still think this is a waste of time to sit here and talk about each man's grade. Here we got his grades, we got all these grades. Let's just average them up and give him a
why don't we
grade.
give him an A?
Well, listen, this kid's got a good attitude, though, and if he's going into orthodontics, maybe you ought to rate his grade a little bit, you know?
Why, what did he get in the lecture?
Oh, well, he got a D in lecture, though.
Yeah, but that lecture doesn't count because, you know, you can get a D, it's a multiple choice, and all you have to do is just, you know, put a wrong mark down. And the clinic shows that he knows his stuff. Otherwise, how could he do B plus A in the clinic and get a D in the lecture? It shows there's something wrong with the lecture.
Well, we all
part
agreed
of it.
then an A minus, since he's a pretty good guy.
Give him the benefit of the doubt.
Yeah, but I think you're outvoted. There's, you know, 4
A minus, yeah.
No
Next
question
guy
about
is
it.
Irving Bluestern. This is our perennial problem student.
He's pretty sloppy in the clinic.
Well, he got a C, a B, C minus, and a C.
But you know, I teach an operative in the afternoon.
Yeah.
And I can tell you, he's terrible in operative.
No, he's that guy with all that long hair. You know,
he's a claw. He's really a claw. I wouldn't do a filling on my dog.
Wear
That guy's
those
terrible.
peg pants, and he's got a mustache and a beard, and
He's always cutting corners, too, Joe.
I believe he belongs to that SDS group.
Oh, I wouldn't be surprised.
He probably does. Well, listen, let's hold with a C minus on him then.
Yeah.
Okay?
Oh, yeah, I'd agree on that.
Okay. Next one is Mike Carpenter. Now, he has a C and a B minus.
Carpenter? What, is he in that class?
Well, yeah. Here's his picture here, see? He's got it incomplete, though. He doesn't have enough bridge work.
Is he doing his own lab work?
No, he's doing lab work for somebody, some dentist out in practice, I think.
Huh.
Oh, they have him do his lab work, eh?
Yeah.
I don't know. Give him an incomplete. I don't care.
Who are we talking about now?
Mike Carpenter.
Oh, listen, I think we're wasting our time here. We can take his grades and let's average it out. Let's be done with this. I don't like this going back and
but how do you
hashing these
average an
grades over
incomplete?
again. I think this is wasting too much time.
You may be right.
Yeah, you might be. You know, we could save a lot of time sitting around these
Well,
grading
you
sessions.
grade them
you know.
once in the clinic and the day it happens, and then behind closed doors here you're doing changing the grades around and all of this kind of stuff.
Let's give him what he got.
Yeah.
Give him what he got.
Okay. This student has 2 C's and 2 A's. Joe, you gave this fellow a C, and Bob, you gave him a C. And then John, you gave him 2 A's.
Yeah.
That's quite a discrepancy.
I just finished up working with him on his 4th bridge, and I thought it was really good. He did an excellent job. In fact, I worked with the 1st bridge he did, and then the 4th one. He had an A both time. I think, in fact, if I could have given better than an A, I would have. He really improved. I think almost an A plus would have been it.
There's just too much of a discrepancy between the A's and the C's. It seems to me that there's more involved here than just a simple matter of grading. I think there's a personality problem here that we better look into.
Well, it would appear to be that, you know, I mean, it seems like, you know, because I did the 1st bridge and the last bridge, but how could, you know, my grades be so much above the grades that, you know, you and Joe Clayton gave? I can't see that unless that maybe it was a personality problem, more like a generation gap more than anything else.
I've been meaning to talk to you about
What was that about
this.
experience?
I say you lack experience. It's quite obvious that you lack experience.
Well, these are all junior bridges. I mean, I've done my junior bridges. I finished up last year.
I've been meaning to talk to you about this problem, John. I think you're an easy grader. This is the problem. You just graduated last year, and you know all these students now personally by name. And I think you're afraid to grade realistically, to give them a C as they deserve, but you give them A's because you're still buddy-buddy with them, and you can't do that.
You can be friendly without, you know, having to be fair. I mean, I think that just because you're friendly doesn't mean you're automatically an easy grader. I
still think that we ought to assign an older instructor to you to review your grades. I don't think that you know how to grade students.
Just a little more experience, and I think you'll be better at it.
If you keep your nose to the grindstone and watch us, I think you'll be able to, you'll eventually end up being a good instructor.
Mm-hmm. Well, everything looks in order, Mr. Williams. We're all set. The cavity preparation is completed. All we have to do is get an instructor to check it, and we'll be ready to fill it.
I do have an appointment, Doctor. How long will this take?
Oh, well, just a couple of minutes once we get it checked. It won't be any problem.
Fine.
There's Dr. Evans.
Yes, Mr. Knapp.
We have a Class 2 on number 28 completed the cavity preparation.
Completed preparation on 28.
Right, right.
Sir, how are you this afternoon?
Fine, sir.
Open for me, please.
Well, that's a sweet prep for a change. Maybe I'll finish on time today. Oh, gee, I wonder if I smoothed that bevel down. What's he taking so long for? I hope he doesn't think I fudged that cement base. It might look that way, but I didn't. I can see I should have gotten Dr. Brown to check this in.
Mr. Knapp, I'd like Dr. Robinson to look at this preparation.
Okay.
Dr. Robinson?
Hello.
Would you please look at this preparation? It's a distal preparation on number 28.
Uh-oh, now I'm in for it. Robbie's a toughie. Just pick all the time. She'll probably even complain about the way I've got the instruments on this tray. Now it's 2:45, and if I have to make many changes, I'll be late for my next appointment. To top it off, the patient's going to think I'm a fool because I told him it was so good. Well, maybe I could just temporize and have Williams back tomorrow. I could cut my 8 o'clock and get started early. Well, here it comes.
Mark, I'd like you to go ahead with this.
Oh, well, okay, thank you, Doctor. Well, I guess we're all set. We can go ahead and fill it, Mr. Williams. Looks fine.
Mark Knapp is going to be a fine dentist.
He did an excellent job on that preparation. It was pretty difficult, too.
He has a great deal of confidence in himself, and I've got a lot in him.
The thing it is, my electric works for about 3 minutes. And then
Yeah,
it's
right. Hi, Fred. George, hey, Ralph. Listen, I wonder if you got a couple minutes. I'm making some films this year up in the TV studio, and I'm trying to get some ideas. These are going to be short films for discussion about teaching situations. Good. Yeah, well, I like the one you were in last year.
You get what, films?
Yeah, and what we're looking for, examples of good teaching behaviors and bad teaching behaviors, so we can program into the films and people can talk about them. I thought maybe you could give me some ideas. Got any thoughts on that?
I don't know, good and bad teaching.
Yeah, I'm tired of getting pimped. I don't know about you guys.
You're what?
Tired of getting pimped by these instructors. Same guys, too, all the time.
What do you mean, getting pimped?
You know, everybody else just like to be pimped.
No meaning to it, it's just a way of life.
It's getting a bad deal, you know, unfair.
Hey, you know that happened to me this morning in clinic.
Every day, yeah, I know what you mean.
We had a clinical on amalgams.
Yeah.
And you know, I'm not the greatest student, and I take criticism pretty well. But this guy comes up and he looks at it. You know, I had stuff all over because I was kind of running late and getting kind of happy and wanted to get. And so he takes the Explorer and goes around the margin, and that's fine, that's nice. And then he puts these loops. Then he puts these loops down over his head. I don't know what they're called, oculars or something. And he looks at it. Well, I can take that because it has to be there. Then he got, they wear ties and something. He takes his magnifying glass. Yeah, you see it. Takes his magnifying glass. So what do you have here? He's got oculars, and he's looking at my amalgam like this here.
Yeah.
And that kind of hassles you. It's nice to go over with the edge of an Explorer and it's to be there.
Do you think he's looking for too much detail or something?
Should have brought your pathology.
More detail. I don't know what he's looking for. He's looking for the grains in the amalgam or something.
Well, man, you have to have somebody check your work and, give it some type of appraisal.
Yeah,
in order for you to really know.
Come on.
Yeah, I'd like to see what kind of work those guys do. I really would. I bet you they don't do any better.
Did he check it with an Explorer?
Yeah, he checked it with an Explorer, and then he puts the loops down, and he brings the magnifying glass out.
So what you should do?
Any other things you can tell me? Good things, bad things?
One thing similar to what Art is just saying is that we ran a little test in our class, and one of the things we did, we had one guy give a wax up to one of the professors and have it graded. And the professor gave him a B+ on this wax up. He thought it was a very good job. So we gave the same wax up to another student and told him to give it to the professor without any alterations a day later.
Yeah, I remember that.
Yeah. There's a redo.
I remember.
So I just question the whole validity of grading.
He had to redo it?
Yeah, he had to redo it.
This is a different person?
Yeah, this is why I question the real subjectivity, objectivity, the
grading in clinic is subjective, and you think that
I wonder, sometimes I wonder what they base it on.
Did the second guy have a tie on?
People with ties do good work, guys.
But this, this actually happened.
Go too much behind your image. In other words, you got long hair. I get certain instructors that come over sort of hostile toward me because my hair touches my collar.
I don't have that problem, Fred.
Yeah.
That's true.
They're more worried about your personal appearance. I mean, I agree you should be neat and everything, than the actual work you're producing, which I don't know.
Yeah, but what about criticism in general? I mean, I find that sometimes the way I'm criticized about something is not for betterment of what I'm doing, but I feel like I'm supporting that person's personality for the day.
Can you judge that, though?
Yeah,
Are you in a
really.
position to judge that on a long-range basis?
Well, personal experience is all I can go on.
Yeah, but he has more personal experience than you do.
Well, you always got to take into consideration, too, I think, that everybody has their up and down days, too.
I think a big.
Now, they're not all bad either.
There's some people that they bitch all the time, and they shouldn't even be here. They can't accept criticism at all.
Yeah, true.
Yeah, that's part of going through school.
But I don't
be willing
think
to
that those students are the majority.
Yeah.
I think.
How about the
what Darryl
fact
says
that,
is
like
right.
in your early years here at school, setting, the theme for yourself, I think if the instructors think that, you do fairly decent work, then you kind of set the theme for yourself.
That's right.
Yeah, but how do you get this theme? You take a fellow comes in here like I did. You got 7 years of college, a master's degree, 4 years in the service, and you're still treated as a college freshman at best. You're given no.
Right. Maybe you're no good.
That's entirely possible.
That's why he's wearing his tie. Yeah.
Piled up against me, guy.
Well, how about you were talking a lot about criticism. Do you think it's generally positive or constructive criticism, or is it negative? Do you get a lot of negative reinforcement?
It's mixed.
I think it's mainly
depends on who you're talking to.
Not what you're doing right, but what you're doing wrong. And after 4 years around here, of just being told what you're doing wrong, instead of being told what you're doing right.
Do you think the system responds too much to negative things?
Because that's the easiest thing to do. It's easy to look at something and say, that's wrong, not all this is good.
Yeah, but you see, you're looking at the positive things of your work.
There's some instructors.
Somebody has to look at the negative parts.
Yeah. Well, how about lectures and the basic sciences and things like that?
That's mixed again. We have some instructors that are really good in the basic sciences, and that really give us a good presentation of a subject that's really hard. And you really don't mind working really hard for it if the guy gives you a little incentive. But when they start bearing down on little minute details and expecting you to learn all that, and you lose the full concept, well, you can't get fired up or anything like that.
Some of them you'll lose the full concept when you go right to sleep.
Lullaby Jones.
Lullaby Jones.
He's a class. Wow, what a lullaby. And at 8 o'clock, too.
Anything else you want to throw out? Any other ideas?
Well, there's this one old guy. I heard all these guys. We were eating dinner here the other day, and they were talking that this old Bob, everybody calls him. Yeah. These young guys, they just can't get along with him for some reason, and they really just think he's just terrible and awful, But I get along all right with old Bob. He takes me to the office, and there's a couple other guys in the class. We go in the office and seen the work he's done like that. And he's helped us out,
he seems like a real good guy, and I guess he is. But I was on a committee with him a couple years ago. And I said something that kind of offended him, and I'm sure he's just never forgotten it. I just get that feeling. I don't know. I may just be making it up, but I don't feel confident around the guy. I'd rather not have him around.
As long as you're doing everything right, you're cool. Once.
It just seems to me that
once you make a mistake,
that's right. When you make a mistake, then you're done.
It's possible, I guess.
Tell me anything else?
Oh yeah. Do you guys? Sad Sam's a perfect example.
Oh, that guy's no good in the clinic.
Have you ever taken his course?
Huh?
My wife, we're upperclassmen now. He's pretty nice in many ways because he takes in the dental wives and teaches them a little bit about assisting.
Nice to you or nice to your wife?
Well, you know, I think he helps. I think he helps the guys out a lot, really, that way. And I can't see where he's all that bad, really.
It sort of helps the wives know what goes on.
Yeah, well, it gives them a better perspective, I think, of what we're doing in our practices, as well as helping us out. You know, legitimately helping us. Yeah. So I don't really. Maybe his course is a little weak, but I think it's really, you know, you got to look at both sides.
He's a good guy.
You know, he's pretty nice.
I took a look at my notes, and I got a couple things down here, but I don't have very much. You know, you give me a lot of great ideas, but I've been too engrossed in them till you can get them down. Thought occurs to me: what if we would bring the cameras down here some noon, and you know, just put them back here, and you guys could sit around just like you're doing now, having lunch.
No,
I don't know.
No, if you said somebody's name inadvertently, it could be edited out, and there wouldn't be any problem. It would make a great trigger film.
Who's going to do that? I've got almost 10 years of school, and I'm not going to take a chance like that.
I don't think you'd have any.
No way, Link. No way. No way at all. No.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.